So next, over to Hannah from Access Social Care, who's going to be taking us through their national helplines data and a little bit around the infrastructure that supports that project.
Fantastic, thank you, Martha, and thanks, Alex. It was really good to hear from you and your thoughts as well, and equally looking forward to hearing from the other speakers today. Alice, I think you might be able to share my screen. I'm not sure if that's still possible or not.
Yep, there we go.
Fantastic. I'll try my best not to sound like Chris Whitty, but I need to move the slides along. Fantastic, that's great. So, so I'm Hannah, I'm a legal manager at the charity Access Social Care, and I'll talk very quickly about who we are and why we were set up in a minute. But specifically today, I'll talk about our Helplines data sharing project. And essentially, we realised that everybody was capturing similar types of data about social care, and that there was power behind that data. It's historically very difficult to try and make that happen. So, but we knew that there was power there. So just a quick summary then of who we are. So just on the next slide, there are some quite stark figures that give you a bit of background about social care. I think it's not news to anybody that the sector's in crisis and is facing a number of different crises at the moment. So the figures speak for themselves, really. And we were founded in April 2020, which was an interesting time to set up anything, let alone a charity. But we were, as a legal team, incubated within MenCap and previously with the deafblind charity Sense before that. So we've existed for a number of years. We provide casework support in social care, welfare benefits, but predominantly social care now. Most local authorities can't meet the need for the growing demand for care, and none are confident in a survey of adult social care directors at local authority level. None are confident that they can meet their legal duties in the future. So we know that the types of demands that helplines will be seeing on national helplines are probably only going to increase. And on the next slide, another stark figure really, so people that might be experiencing problems accessing social care because of local authority funding problems rely on legal aid to be able to access justice, and that's dropped by 92% in the last 11 years. It's a stark figure, and it kind of it's the backdrop to everything that we do at Access Social Care. So data does work. We know that. We've gone through the blood, sweat and tears of making the project work. And as I said at the beginning, there is power behind that. On the next slide, I've just summarised our own model at Access as to how we gather data from our members who are largely frontline national and local care providers, and also helplines. So MenCap's Learning Disability Helpline is an Access member. So what we will do with those organisations is essentially public legal education to begin with. So legal capability training to train up the boots on the ground. What should we be worried about? When is there a social care issue? When do we refer in? They may be skilled up enough by that process to be able to resolve a lot of the problems themselves, or they may need to refer in for casework support, so that's the second sphere really of what we do, casework support, some one-off advice for managers, helping them on the ground. How could you resolve your social care legal issue without recourse to either our casework or legal aid? So we have a network of law firms who we might refer to if appropriate. That all then feeds into the third part really, which is the data capture. And we've spent a number of years kind of tweaking and defining as a team, both at MenCap and at Access, what data we are collecting, what's relevant. This obviously changes with the times, and the pandemic was a pretty good leveler in that respect. So we had to adapt and start thinking about what else do we really need to be capturing. That then feeds into a number of things really for us, it could feed into the campaigning or policy work, or it might feed into local influencing. So we had a case in Essex where our data told us there was a problem with the local authority requesting deputyship for a particular process within the local authority. And we worked collaboratively with Essex to resolve that. So there are lots of different ways that we can use that data once it has been captured appropriately. So this is sort of very, very whistle-stop tour of how helplines record data generally. So Access holds data from our members, from our frontline care providers, and from MENCAP's Learning Disability Helpline. But we know that helplines generally record pretty much the same type of information. So however it comes in, email, phone, even post, largely the details that you can see here, largely they are recorded by each helpline, and that's the sort of data that we might collect and do collect as part of our helplines group. It's all anonymised, so no names, but we will collect local authority and the type of issue the call is about. And we know, well, we didn't know, we had a feeling that each helpline would probably reliably be able to provide that data, and that then fed into, on the next slide, considerations around, well, if they are recording data, can we harmonise it? And the answer was no, because everybody was recording the same thing quite differently. So for example, I'll pick the advocacy and assessments example. A person may call a helpline because they have had a needs assessment, they have social care needs, and they also had a legal need to have an advocate present at the assessment, and they were concerned because they didn't have one. And this is an example from our members as to how they all recorded that same issue quite differently. And we started to unpick it through a series of workshops. Are these the same things? Are we looking at the same things? We think we are, but we don't know. We were, luckily, we were. And how can we agree on terminology? Because if we were to try and harmonise these data sets to gain greater insight from the data behind what's coming into the helpline, as you can see, it's impossible to do with the categories that existed. So we made up some new categories. We held a series of workshops, and it was really trial and error. And I think the benefit of my role, so my role as a legal manager here at Access is funded through the Bearings Foundation, and I can put a good amount of time and resource into collaborating with the sector to really unpick what are the barriers here, how can we make it work, kind of back to the drawing board more than once to try and make a kind of system of harmonising that data work. So there's a very kind of brief snapshot there of, we have about 10 universal themes that pull together all of the data from our different helplines. So that's Age UK, Carers UK, Independent Age, MENCAP, our own data at Access, and it pulls them all through using this sort of universal theme system. And we then have kind of 5-6 times the data and power and insight behind that to be able to use in whatever way our organisations want, really. So we've mapped 1,000 different organisational categories to these universal themes, and our most recent report, which I'll talk about very quickly in a minute, dealt with 40,000 different calls through on social care. So kind of getting the basics right at the beginning, we've been able to kind of feed in a lot more than we would have done using the original categories. The next slide I won't spend too long on, mainly because you probably can't see it in any great amount of detail, but this is a pipeline that was built by MENCAP's lead data analyst, and essentially it's a bespoke pipeline. We put in all of the data from each organisation, and it spits out magically to me a data set at the end, and you can then use any kind of analytics software that you need to. It will group them all into universal themes. And on the next slide, just a couple of examples really about what it looks like in various different ways. So, you know, feelings that we thought we were all seeing the same things, you can now demonstrate actually, yes, we are, or no, we're not, and who is that affecting more than others. And we could really start the process of analysing what we knew to exist at that point. A little bit on the right there about local authority data. We don't do too much work as a group on local authorities. We will leave it up to our membership to decide whether there's any campaigning that wants to be done or collaborating with local authorities, but it's helpful to start building up a picture at local level. So our State of the Nation report, which is available on our website, as I say, brought together 40,000 pieces of separate data and identified key trends. It was quite well received. So we had media coverage from BBC News, Times Radio, Sky, and we'll keep reporting quarterly, doing interim updates. A very brief graph there, no surprises, a peak at the start of the pandemic and then a second peak as we entered the second wave. It's not surprising, but it was helpful to kind of see that we were all witnessing the same thing. And on the next slide, we can see kind of more of the patterns really as to what the universal themes looked like. So obviously no surprises that COVID came in 2 waves, but some of the other categories started behaving in strange ways, actually, for some of them, and in other ways quite predictable. And some of the key findings just on the next slide are quite stark as well. So we all know that carers bore the brunt of quite a lot of care and support being shut down in the first wave, and the figures speak for themselves. I think, you know, nearly 400% increase, and we're talking about in 1 year from 2019 to 2020, 84% increase in needs assessment advice demands. And we know this is happening across all groups that the helplines are serving, so older people, working age, carers, you know, it's happening across the board. And the last couple of slides really, I won't read all of this out, but it's kind of to give an example of how we hope the project might help the sector, really, both the social care sector, but more widely, the legal sector that supports it. So I think we're hoping it will be helpful in 2 ways. One, it might inform legal aid lawyers as to where issues might be emerging, and 2, it might support strategic cases that are already listed. And then moving on to next steps, I think I've touched on some of this already really, but influencing, we hope that some of our members might use the data to be able to support their influencing or policy work. It may also be helpful in a practical sense, you know, where do we need to focus our service delivery as an organisation? And we will be producing interim reports every 3 months and making these available on our website so that we can monitor kind of, if you like, the trends that are coming through, what's going up, what's going down, where do we need to be worried, and we're also in the process of onboarding more members at the moment, which is really exciting because that will start building the volume. And the last slide is really just if anybody is interested or wants to talk about joining or wants to talk about the learning really that's come from us running this project, please do get in touch. But as Alex said, I'm really looking forward to hearing from the other speakers, and I'll leave it there.